This is Joe Mullings with The Other Side. Today, my co-host is Doug Billings. Doug is the Managing Director and leader at Deloitte in their MedTech practice. And also joining us today are Felix Matthews. Felix is the Managing Director and Physician Leader at Deloitte. And our special guest is Joe Devivo. Joe is the CEO of InTouch Health. And Joe, thanks for joining us.
Thank you, Joe.
You bet. Doug, take us out of the gate, would you?
Certainly. Joe and Felix, we've seen, in the last several months, a tremendous growth in the use of virtual health in a lot of dimensions. Joe, would really love to hear, how is care changing with this dramatic growth in virtual health?
Well, it's been a necessity. Patients have been afraid to go into doctors' offices, and the only way to provide care in this environment has been through virtual care. And there's a lot of different definitions of virtual care. We've been working in high acuity neurology, intensive care, behavioral health for years, decades. But now we see physician practices rushing to bring in virtual care, and it's met some near-term needs. Of course, even in the delivery of care for COVID-19 patients, we can reduce the amount of touch points a caregiver has, reduced the PPE. Keep separation. Even caregivers who are quarantining at home are using applications to treat patients. So it's a way to leverage the system when the system has challenges face to face.
Thanks, Joe. Felix, your position, what do you think about these changes, and what are you seeing happening out there with the providers that you work with?
Well, the first association with virtual health is always televisits, which is interactions between a clinician and the patient. And so we're all familiar with those. They've been happening for a long time. What we're seeing now is a much broader transformation across the entire healthcare continuum, starting with wellness and prevention, and the whole outpatient and patient spectrum, but all the way into healthcare administration and even clinical research aspects. So two areas I maybe call out specifically, because there's a lot of movement there right now, is hospital at home, which is the provision of care services that would traditionally have been provided in a hospital, but are now made available in the convenience of a patient's home at a lower cost, and protecting patients from an exposure to possible hospital pathogens. And virtual technologies are really an enabler of that type of care setting shift. The second one I might call out here, which is maybe talked about a little less, but is nonetheless important and gaining in importance, is care management. To date, care management has been care managers calling patients to check in on them, remind them about their health care, the treatment plans. But now we're moving towards virtual assistants, remote monitoring, multi-channel interactions, which makes the experience very different for patients and their families.
Felix, as we look at the crisis, we look at the virtual needs. Joe mentioned PPE. The centers of care are changing outside the classic hospital. Are these changes likely to stick as we move forward?
I think they are absolutely going to stick. And I might mention three in particular which come to mind. The first is a telehealth first approach to primary care. Patients will readily do a video consult before making any physician office appointment. And similarly, where the PCP would traditionally come back in 3 days if you don't feel better, they'll now offer something more like, let's do a video chat in 3 days and see how you're feeling. The second area is a willingness by health consumers to share their personal data, their information, be it through online surveys. So everybody has learned how to fill out a COVID screening online and share a lot of personal information. And that's going to continue to the use of apps and online tools, and a greater willingness to do so. And the third area where I think we'll see a stickiness is a broader rethinking of hospital-based care, where physicians have become much more comfortable in remote monitoring, a willingness to critically reconsider what needs to be facility-based and what can be offered in the home or in lower acuity settings, just like we spoke about earlier with hospital at home settings.
And Joe, you are a battle-tested vet of the medtech industry, going back to Mr. Leon Hirsch days that you and I know very well. And now you are at the forefront of this digital sort of transition. What are your thoughts coming from that legacy classic medtech world and now moving into this teletherapeutic, teleproctoring world. Your thoughts on the stickiness of this, or is it just a passing sort of scenario?
Well, first of all, I think Felix is 100% correct in how he's identified those use cases. Uh, the incentives need to continue to be in line to ensure that they happen, and the incentives will dictate the behavior, unfortunately, which is evident of the lack of adoption of telehealth prior to this. For all of my prior experience in medical device, coming into kind of IT, you have healthcare IT, and sometimes you have to ask yourself the question: where does IT end and healthcare begin? Because the more you treat patients digitally and virtually, the more you have to build the type of medical grade quality, security, encryption, reliability standards in virtual care. And we've seen the industry rush to basic video conferencing equipment to do this, off of necessity, which is completely understandable. But it has to come back to, if a physician, especially in a critical environment, is remote and they're required in a time-sensitive way to provide care, how do you manage quality? And so being in medical device and being in a regulatory environment, I think there has to be some rules of the road. There has to be some compliance, and there has to be quality built into this, because the consequence to the patient, if you're truly requiring someone to be there remotely for critical care, is very high. And so the market has to settle back into, how do we do this, but how do we do this safe and effectively?
So I really appreciate that focus on the patient, Joe, and what that really means to do, and in the environment that we're all used to working in, and sort of the criticality of the quality of what we do. That's a whole set of implications in itself that I'd love to expound a little bit more on for MedTech. And what are some other implications for MedTech, in addition to sort of, okay, we got the Wild West going for a couple of months, but now there's other things we need to do. What are some of the other implications?
Well, what's really exciting is when you think about virtual care, you think about, well, what can you do over a video? But there's a complete digital journey that a patient can have in the healthcare system now. You think about banking, you think about air travel. They've done marvelous jobs of engaging consumers to actually take the first step of their intake and of their engagement. And then they manage their records, and they have their ability to be proactive in their healthcare or in their interaction. We can do that for healthcare too. It's not just about a video visit. It's about digitizing their interaction, so the patients can be more involved in the delivery of their care. They can have their data, and then they can be involved in their intake and take a lot of the processing burden off of the health system, and have patients take a greater interaction. So it's not just about virtual care. It's really the initiation of a digital revolution that started with EMRs 15 years ago, that now we're seeing video and virtual care, and ultimately is going to evolve into patients taking ownership in preventative care. I remember going to a doctor, starting to have high blood pressure. They said, I was 140 for my cholesterol. You're fine. Next time I went, I was 160. Next time I went, I was 180. They said, fine, until I hit 200 and said I had to go on a statin, which is crazy. When you saw the 140 to 160, maybe I could have done something differently and been more proactive, but I just cost the healthcare system. And getting that level of proactivity and managing your data and your health, I think, is going to be a very positive outcome of this all.
So that's great, Joe. Felix, I mean, is the medtech industry positioned with the right products to support that? What does the medtech industry have to do to support that digital journey and that level of patient empowerment?
I think that there are definitely great products out there and wonderful devices, and I totally agree with the digital journey that Joe just laid out. Very important from a consumer and from a patient perspective. What I might add to that is the clinician or care team lens, and I believe that there's an opportunity for MedTech to really have an impact there. We recently surveyed over 500 physicians and found that the technology systems for virtual care are deemed woefully inadequate, and workflows remain tedious. So my takeaway for the MedTech industry would be one-off point solutions need to be retired and in favor replaced with integrated solutions. And that means developing interfaces between existing healthcare IT on the one hand, advancing industry standards and protocols and facilitating integration of data feeds across devices from different vendors, and really making the workflows of the physicians more palatable. And in particular on that second point of managing workflows within the clinical setting, it's not enough to just drop a new technology or a new device into a clinic or give it as a consumer patient device. You need to have commensurate training and process design around it so that the entire care episode is designed and integrated and makes it really a good experience, not just for the patient, but also for the care team. And I think MedTech has a huge role to play on both of those fronts.
Felix, you mentioned something there very interesting. Is you talked about healthcare IT, and we've also spoke about EMR. And EMR, if you ask some people, is more about billing and less than patient empowerment. And as we look at this telemedicine and this real-world data collection, how does that empower the patient and the patient care from an IT perspective?
It might be helpful to first provide a little bit of structure on what is real-world evidence or real-world data. That typically refers to information generated by patients or research subjects outside of the clinical setting, therefore the word real-world. And it can really be grouped into two categories. It can be continuous measurement or interval-based measurement. So continuous measurement would be things like EKG or continuous glucose measurement. And then interval measurement could be things like patient-reported outcomes, so surveys, social measures, or even the integration of treatment plans. And I see that Medic has got a big role in creating a platform that integrates these different data feeds. The patients are more willing to generate the data and share the data, like we discussed earlier. But now you've got this tsunami of data feeds. And there needs to be some coordination, aggregation, and analysis done with the data to make it useful and to transform how care is delivered. And I see that MedTech has got a huge role there in combining, analyzing, and taking action, really linking the analysis to actions that improve healthcare.
Joe, you had taken us through I'm hoping not too much of a real world journey on your analog experience in old school medicine when we talked about your cholesterol, 140, 160, 180. You know, an algorithm on a predictive analytics side would have caught that in a second and said, hold on, there's a trend here that doesn't make sense. So how about InTouch, and what does something like that system represent in acquiring data, and in what ways can it acquire that data and predictively earlier intervene, offering better for the cost of healthcare, better care by the physician, and ultimately what's best for the patient?
Well, you know, to Felix, thank you for the question, Joe. To Felix's point, we are all going to become awash in data, and the question is how are we going to use that data in order to effectively provide care and help physicians? You know, when I think about this first phase of the digitization of healthcare, the doctors have been the big losers. They've had to put much more time and energy into a basic consult and the creation of the record. They're getting reimbursed less. They're stressed. They're not as productive. They need to win, and they need a win, and they need virtual care as one of the ways that they can recapture their life, recapture their balance. And by having all of this data available, there are machine learning and AI scripts that could, you know, create, just as you said, that should be just obvious that, hey, Joe's trending in the wrong direction. We need to do something for him. But it's all about the back end data systems. And the good news is data is pouring in. The bad news is the data is not integrated and collected in a manner that allows for easy processing. You know, when we talked last year, we talked about this digital window. Right now, there's a digital window amongst all of us. And InTouch is working on ways, and will become Teladoc, ways where right now, you know, I could see your blood pressure through the video, or I can see your blood oxygenation through the video. I can see the fact that you're scowling at me right now and that you're mad that I'm talking too much. And I can see your smiling. So then that would tell me. But so what we're trying to do is use the not only the data to become smarter, but the interaction to become easier. And then as we're communicating, because we're communicating through audio, also we can take and automate a note. And so we know how Siri works, we know how all the dictation works, but having AI cue on certain terms that then by the end of our dialogue has a fully note prepared that they just review for accuracy. The physicians have to win now. They lost in the first round of digitization of healthcare. They have to win in the second round.
Couldn't agree more, Joe.
Yeah, and thank you, Felix, because look, unfortunately, this is where we are in a crisis. I think it was Churchill who said it, is a terrible thing to waste. And while we all have watched this slug along with digital until we reach this point, and we can point back to March 2020, there's no doubt in when we did cross that chasm, this digital, I would call it windmill we've been fighting to date, I think finally has become realized. And Felix and Joe, thanks so much for sharing your thoughts on this. Doug, do you want to take us out?
Sure. Thank you, Joe, and thank you as well from me, Felix and Joe, to the comments you've made. And I think that giving a win for the physician, that's nothing else. That's the banner to take away from the conversation. If we can get wins for the patient and then create this set of wins for the physician, we really can have that transformation of healthcare that I think MedTech can really make a leadership role in. So excited to hear that from two folks like you, that gives us a good mission to focus on.
Absolutely. Well, Doug, thank you so much. Felix as well. And Joe, as always, it's been great. This has been Joe Mullings with The Other Side.